afternoon, everyone. I'm Jehan Lumayag from Section Amethyst, and I'm going to discuss the bacterial infection of gastrointestinal tract, namely the disease of typhoid fever and shigellosis.
Hey guys, this is Princess Laika Basilad from Section Amethyst, and I'm going to discuss the bacterial infections of gastrointestinal tract, namely the disease of cholera and salmonellosis.
A perforated intestine occurs when your small intestine or large bowel develops a hole, causing intestinal contents to leak into your abdominal cavity and triggering signs and symptoms such as severe abdominal pain, nausea, vomiting, and bloodstream infection or sepsis. Next is pathogen. The etiologic agents of shigellosis are Shigella dysentery, Shigella flexneri, Shigella boyei, and Shigella simini. They are non-motile gram-negative bacilli that are members of the Enterobacteriaceae family. A plasmid is associated with toxin production and virulence. Next is reservoirs and mode of transmission. Infected humans serve as reservoir. People become infected by direct or indirect oral transmission from patient carriers. Fecally contaminated hand and fingernail, like touching objects. For example, you may change the diaper of a child who has shigellosis. If you don't wash your hands thoroughly, you could leave the bacteria behind on objects you touch next, such as changing tables and toys and doorknobs. Or fecally contaminated food, milk, and drinking water, like eating people handling or preparing your food may have shigellosis. If their hands aren't clean, your food may be tainted, or your fruits and vegetables may have been growing on a field that has been contaminated with human feces. Signs and symptoms of shigellosis usually begin a day or two after contact with Shigella. Signs and symptoms may include nausea, vomiting, cramps, and fever. Sometimes, toxemia or toxins in the blood and convulsion in children occur. Leukocytes will be present in stool specimens. Fresh fecal or rectal swabs should immediately inoculated into gram-negative enrichment broth and into a solid medium such as macunchi, xylus, lysine, deoxycholate, or hectone enteric agar. Patient care. Use 10 precaution for hospitalized patient. Add contact precautions for diaper or incontinent. Typhoid fever is a life-threatening illness caused by the bacterium Salmonella typhi. It is a gram-negative short bacillus that is motile through its flagellum. Gram-negative bacteria are pathogenic, meaning they can cause disease in a host organism. System involved is digestive system. The most serious complication of typhoid fever is intestinal bleeding, or holes, may develop in the third week of illness. Intestinal bleeding is often marked by a sudden drop in blood pressure and shock followed by the appearance of blood in your stool. About 5% of people with typhoid fever experience this complication. Next is reservoirs and mode of transmission. Infected humans serve as reservoir. People become infected by direct or indirect oral transmission from patient carriers. So, what are the signs and symptoms of typhoid fever? Although children with typhoid fever sometimes become sick suddenly, signs and symptoms are more likely to develop gradually, often appearing 1 to 3 weeks after the disease. Laboratory diagnosis. Diagnosis of typhoid fever is made by isolation of S. typhi from blood, urine, feces, or bone marrow, followed by identification biochemical tests. Immunodiagnostic are also available. Patient care. Use 10 precaution for hospitalized patient. Add contact precautions for diaper or incontinent.
Salmonellosis. Salmonellosis, or also known as the salmonella infection, is a gastroenteritis with a sudden onset of headache, abdominal pain, diarrhea, and sometimes vomiting. Did you know that about 40,000 cases are reported annually according to the CDC? Next is the system involved. The system involved by salmonellosis is the digestive system, particularly in the gastrointestinal tract. Next is the pathogen. The pathogen that caused by salmonellosis is a family of Enterobacteria that is currently named as the Salmonella enterica. These gram-negative bacilli invades the intestinal cells that release endotoxins and produce cytotoxins and enterotoxin. So next is the reservoir and the mode of transmission. The reservoir include the wide range of wild and domestic animals, such as poultry. Also the reservoir of the infected humans, such as the patients. Next is the mode of transmission. The mode of transmission occurs via the ingestion of contaminated foods such as the eggs, unpasteurized milk, meat, poultry, raw fruits, and vegetables. Also, the fecal-oral transmissions from person to person, food handlers, or contaminated water supplies. The sign and symptoms of salmonellosis. First is the sudden onset of headache, abdominal pain, diarrhea, nausea, and sometimes vomiting. Also, it can lead to a severe dehydration. Next is the laboratory diagnosis. The stool specimen should be submitted to the microbiology laboratory. Salmonella are non-lactose fermenters and thus produce a colorless colonies on McConney agar. Biochemical tests are used for identification, and commercially available anti-sera are used for serotyping. And lastly, the patient care or nursing consideration. The use of standard precautions for hospitalized patients, add contact precautions for those diapered and incontinent patients. If your doctor suspects that you have salmonella bacteria have entered to your bloodstream, he or she might recommend you to drink antibiotics. So what is cholera? A cholera is an infectious disease that can cause a severe diarrhea and can lead to a severe dehydration. If untreated, it can lead to death. So did you know that more than 50% of people died from severe diarrhea? A cholera occurs worldwide with its periodic pandemic and epidemic. A cholera pandemic that started in Peru in 1991 killed more than 10,000 people. Most U.S. cases involve the ingestion of raw or undercooked foods from the coastal waters of Louisiana and Texas. So next is the system involved. The system involved in cholera is the digestive system. It is because the deadly effects of the bacteria is highly affected the whole process of digestion in our body. Next is the pathogen. So the pathogen that are present in cholera is called Vibrio cholerae group. These are the curved, comma-shaped gram-negative bacilli that secretes an enterotoxin, which is a toxin that adversely affects the cells in the intestinal tract. This is called the choleragen. This bacteria release a toxin that causes an increased amount of water to be released from the cells that line the intestines. This increase in water produces severe diarrhea. Next is the reservoir and the mode of transmission. So, Reservoir include the infected humans and aquatic reservoir. The mode of transmission occurs via the fecal route, contact with feces or vomitus of infected people, ingestion of fecally contaminated water or foods, especially those are raw or undercooked shellfish and other seafoods, or it is mechanically transmitted by the flies. Next is the signs and symptoms of cholera. The person who have cholera experience the following symptoms. So first is the acute bacterial diarrheal disease with profuse watery stools. Second is the occasional vomiting that can last for many hours. And lastly, the rapid dehydration. This dehydration can lead to rapid loss of minerals in your blood that maintain the balance of fluids in your body. This is called the electrolyte imbalance. Laboratory diagnosis. Rectal swabs or stool specimens should be inoculated into thiosulfate, citrate, bile, sucrose, or TSCBS agar. Produce different reactions on this medium. The biochemical tests are used to identify the various species. Biotyping is accomplished using commercially available anti-sera. Patient care or nursing considerations. The use of standard precautions for those hospitalized patients. Add contact precautions for those patients that are diapered or incontinent. Since we all know that prevention is better than cure, so here are the following prevention that we must follow. First, drink and use safe water. Of course, we need to drink water that are safe in our body. Wash your hands often with soap and safe water. Before and after eating our foods, we must too wash our hands so that our food won't be contaminated with different microorganisms since they are present everywhere. Third, bury your feces properly. Do not defecate it in any bodies of water. In this case, we must apply good manners. We should not eliminate our waste everywhere, especially in the bodies of water. That is why comfort room is designed for us to have a proper elimination. Cook food well. Cooking our food properly would at least eliminate those unwanted harmful microorganisms, which might be harmful to our body. Fifth, clean up safely your surrounding. Of course, we don't want our place to be also the place of different microorganisms, which is very harmful. So when it comes to treatment, rehydration is the must. The goal of rehydration is to replace fluids and electrolytes using a simple rehydration solution, oral rehydration salts or ORS. The ORS solution is available as powder that can be made with boiled or bottled water. Without rehydration, approximately half the people with cholera die. With treatment, fatalities drop to at least 1%. But the best treatment is to seek for medical help or medical care.
Good afternoon, everyone.